Hello, everyone. I am Adrienne Good, and this is Dental Insider, Good Dental Media Insider, and I'm joined by Dr. Vajahat Yar Khan. He's a board-certified pediatric dentist, entrepreneur, inventor, and founder and CEO of DentTracks, an AI-driven dental business management platform helping practices streamline operations, insurance workflows, scheduling, analytics, and patient communication. Dr. Khan has a unique background spanning clinical dentistry, academia, and technology innovation. He previously served as an assistant professor at the University of Texas Health Science Center in Houston and has built multiple companies focused on improving efficiency and profitability in dentistry. What makes his story especially interesting is that he built DentTracks from firsthand experience managing practices and solving real operational problems dentists face every day. Today, DentTracks is helping practices use automation and AI without losing the human side of dentistry. Dr. Khan, welcome.
Thank you, Adrienne. Thank you for having me on the show.
Now, I do want to ask you kind of like your origin story and ask some questions about AI, but I will say I walked through a presentation that you gave. I've seen you at some pitch events, but I got to kind of go on this journey with you and see the back end of this platform that you offer, and it's pretty robust. There's a lot to it. I mean, I would ask a question and you would have an answer for it as far as the systems and processes go in everyday dental office. So you've definitely thought about all the nuts and bolts that goes to managing a practice, and it's all in one place. It's pretty cool.
Well, thank you. So, I mean, the story began when I got my first practice. It's a big story before that, where I came to this country with only $85 in my pocket. Wow. And I did not have a way to pay my first semester tuition fee. Along the way, a lot of people helped. First of them was Dr. John Dane, who created a position of a dental assistant for me after hours. After I saw all my patients in my residency program, I would take calls for all the patients that would show up after hours, and then clean the sterilizer, autoclave, clean the processor, get the day ready for the next day. So that was my first step, and working here in the United States. And I tell everybody, I mean, this is a country of dreams, and the dreamers are welcome here. So if you have the talent and the merit to be able to achieve greater heights, nobody is stopping you over here. So that's my story. And then when I finished my residency, I joined as a faculty at UT Houston teaching pediatric dentistry. An older gentleman, Dr. Freddie Cisak, a pediatric dentist, introduced me to one of his friends from dental school. He was not having success with selling his practice because it was really old, but it fit my philosophy because I was trying to look for something that was less priced, obviously, because I didn't want to get a bank loan. I could not get a bank loan. So I just got owner financing done from him, and that was my first practice. Like day one of my practice, I realized that credentialing was so difficult, and then I didn't have any idea about billing. And then just started learning from the grassroots level, did my own claims, did my own credentialing. My wife helped me with my credentialing. So all these pain points that I experienced over my journey as a clinician operator who had limited resources to function, is how I realized, okay, this is also disconnected, so fragmented. Everything has to be done in a way where it does not pull the data from whatever I did previously. So I was like, okay, there has to be a better system. So that's when I started realizing that these systems have to be built, and that gave origin to this thought process of building an AI power. I mean, not at that time, it was not AI at that time, it was automation. And then the workflows have transformed from automation, which are script based, to autonomous, which are results based. So now practices are looking for things where everything that they want to implement will actually do the work for them. Example of that is, they're not looking to get a dashboard with KPIs showing them, okay, you have $250,000 sitting in your AR. They're asking, okay, if there is $250,000 sitting in my AR, how can I get that money? That's the result. And I don't have the resources to work that. So I'm like, okay, I can deploy my AI agents that can get you most of the results, but then we can put human in the loop to get the other results. So this way we are able to tackle that $250,000 worth of AR in quick time, where a practice is busy and cannot deploy that human capital to undertake that. So
Right.
so that's how everything merged and mingled to where the idea gave birth to an actual product that gave birth to a multitude of products as we kept building. So I've been building for the last 6 years, and then that's how we have created this monster. I call it's kind of big product.
So quickly walk me, because it's tough, because I've seen some of your presentations, and I've a few times, and it was still hard for me to really fully wrap my mind around the different components that this product has to offer. Obviously, we know AI is connected. We can talk about that in a minute. But what I want you to maybe just list out is that, and not in full detail, but just list out the categories in this specific departments that you can use this software for.
Okay, so in short, if I want to explain.
So what is it? Billing? Just start from the top.
Yeah, so patient engagement.
Patient engagement. Okay.
Then verification.
Verification.
Claim submission and statusing.
Claim submission and statusing. Okay.
When the claim is paid, then account reconciliation between the bank and the PMS.
Account reconciliation.
If the claim is not paid, then denial management, and then payment.
Okay.
Then the compliance piece, where we make sure that the personnel in the office as well as the facility is in compliance with the regulatory bodies.
Okay.
Then Dentalytics is analytics and business intelligence tools.
Okay. Then
we have Dencentive, which is staff accountability and incentive gamified.
Okay.
And then we have DentOrtho, which helps you take care of ortho patients within the same PMS and our platform.
Okay.
And then we have DentProfit, which helps you streamline your resources in a way where the profitability is higher.
Okay. And so this is a product that you use in the back end. Staff has access to it too. Do they have their own user accounts or?
Yes. So the way we onboard is we onboard the organization. Mm-hmm. Then if they have 5 offices, we onboard their offices. Then we onboard their teams, and then we onboard individual users. So that's the hierarchy.
Okay. Okay. Thank you for explaining that, because there's a lot to it. So it's good to just kind of list that out quick. So you've said dentistry has historically been slower to adopt technology compared to medicine. Why do you think that is? And where do you believe the biggest inefficiencies still exist today?
The biggest problem, I think, is the point solutions that we have in the industry. So there are really cool companies that are solving specific problems. So at one point of time, I had like 15 different technologies that there were different logins for them, and then everybody would be always lost. Mm-hmm. Apart from that, what happens in this situation is, say, for example, you have a patient engagement tool, and then you have a verification tool. The data that's sitting in here does not communicate with the data that's sitting here. So you still have to do additional data entry or pull the data out from the PMS, which is not integrated at this level. So that data lake concept that technicians and technologists talk about, that data lake concept is missing in dentistry. That interoperability between the different point solutions is missing in dentistry, which is being adopted on the medical side. So I think that we are slow to adopt, but this whole push that we are seeing in the market for interoperability and the mouth-body connection, like oral systemic connection that we are seeing, where even the medical side and the insurance side is starting to realize that dentistry is a big part of the overall health. Now this will bring about a change where maybe dentistry will become a part of medicine. And then that will also be something that people are looking at, and it'll help the technologies build that way too.
Okay. So everyone is talking about AI right now.
Yeah.
But most dentists still don't fully understand how it actually helps their office day to day. So what are some practical ways that DentTracks is using AI to improve scheduling, insurance, communication, and profitability? That's a loaded question, but
Yeah, so I'll simplify it for you. So AI, mostly it's generative AI that everybody is using. So they have like basic platforms where like Claude or ChatGPT and stuff, and then within those platforms there's a lot of data available, and you can pick up certain elements of that and create a model and then train that model, right? So what people are using mostly in dental field is generative AI being used for voice communications, like voice AI they call it. I call it a functional voice AI, where an AI can communicate with your patients, it can communicate with insurance agents, it can communicate with your staff, right? So there are engines for outgoing calls, there are engines for incoming calls. So that's one piece. It can be something where it can function as a front desk and then make an appointment for you. Second thing is the document processing AI. We all know that dentistry is filled with documentation. We are loaded and overwhelmed by documentation. So what we have built is document processing AI, where we are able to ingest all the documents that we can ingest. Even now, they come in the form of paper EOBs, paper faxes for eligibilities, everything that comes in paper form, we ingest it and we process it so that we can take out the elements that are necessary to handle a particular situation to give the best results. Again, everything is based on results. So in case of say an EOB, we pick out specific elements of where the payments are to be posted against those specific charges that are in the ledger. We pick out elements like denial codes, and denial management system takes them on, and then we can show it to our users.
Right.
Exactly.
Okay.
And then so that you can submit the claim in faster times. Now, what I'm also seeing in dentistry happen is the physical AI is being utilized, where the physical instruments and devices that we use will have AI built into them, like toothbrushes, where AI will determine, okay, this area has more plaque, so it will brush that area more than the other areas. Or it will be able to detect hard tissue versus soft tissue, and then we can utilize the same device to do scaling, which is supragingival scaling. So there is work being done in that respect. I'm a part of a couple of those type of projects. So exciting things coming.
All right, that is exciting.
Yeah.
So if you were to give any advice, if a dentist is listening today and they're feeling overwhelmed by staffing shortages, insurance headaches, operational chaos, what's the first thing that they should focus on fixing inside their practice?
It's very, very important to fix the leaky buckets. I call them leaky buckets. The easiest thing you can do, I can give a roadmap. Okay, go make a list of all the tools that you're using. Okay. Then identify how many of those tools are truly built on automation, and then they're imbibing or extracting the data from the PMS and not having to do too much of data entry. See manual versus automation. Okay, list them out separately. Then look at the tools that you have hardly used from that list. Like, you've had that tool for 6 months, and how many times have you actually used it? Make the list of that, and then sit down with your staff and ask them, where are the issues? And then you combine all these 4 things and ask yourself, where is your leaky bucket? And if you are able to identify that leaky bucket, then, give me a call, and then I can discuss that leaky bucket with you and how to resolve your issue. So absolutely, I think, this guideline will help at least people who are not even looking at what they're spending on to determine where their leaky buckets are.
Right. Okay, thank you for that advice. And because you are deeply involved in innovation, and you did touch on a few things that you're working on, looking ahead 5 to 10 years, what changes do you think will completely transform how dental practices operate?
The biggest thing I feel is the profitability metric that we see in today's day and age is a lot dependent on our resources. Our operational expenses are really high, because the resource cost has gone significantly up. So what my intention in the shorter and the long term is to improve that profitability, bring that operational expense, which sits at about 45 to 55% right now, down to 20 to 25%. Whether it's reducing the sizes of the office is concerned, whether it's reducing the number of staff members or repurposing the staff members is concerned. So with that objective in mind, if I'm able to bring that to like 20% of operational expenses, then we will suddenly have 30% of extra to work with. So if there is a single operator who does great quality dentistry and still is feeling the pressure of cash flow because they spend so much time with their patients and they're not focusing on business too much, I want to give them reassurance that don't stop doing what you've been doing and connecting with your patients, because that's golden. That's what drives dentistry. That's what makes dentistry different than medical side, where the whole medical side has been taken over by corporate. Continue to do that and focus on these tools and measures that you can take on a very small basis to improve your profitability, and look at those 5, 6, 7 metrics that I'm giving you, which can help you really hone into the items which can cause harm to your practice, and this way nobody is going to make you a victim of embezzlement, fraud, and leaky buckets, where you're able to put that money back into your pocket.
I know that you have multiple practices, so this is something that can be used in, I would say, what scale of like small DSO, large DSO, like what's your target market for this product, and then maybe talk about your own group practice that you have, right?
So DentTracks OS is built for all sizes of practices. But the first thing I tell users of DentTracks OS is that what I will bring to the table right off the bat is, if you have a front desk, repurpose them. You don't require a front desk. I have eliminated all front desk positions from my practice, and that's big. That's $4,000, $5,000 worth of expenses that I've totally eliminated. So in my offices, we only have patient touching people, and there is one treatment coordinator that runs the floor and then makes sure that patients are taken care of in terms of whatever questions they may have. So there may be some overlapping roles of a front desk that a dental assistant has to do. For example, my AI has made an appointment for the patient. Because it's one ecosystem, while it was making the appointment with the patient, it also captured information of the insurance, passed it on to the dental insurance eligibility verification tool that has already run the eligibility for the patient, and everything is available on the insurance tables. So if the treatment plan gets made for this particular patient, it will be very accurate because we run intelligent eligibility verification. Now, when the patient walks into the office, my AI will tell the person who clicks the name of the patient that, okay, off of the 20 roles that you are assigned as a front desk, I have taken care of 18 of them. Now you're only supposed to do 2 roles. One, take the consent from the patient, example, and then second, okay, collect $50. So now we have given very targeted approach to the person who's greeting the patient. Okay, take a consent, collect that money, move the patient to the back. Now when the dental assistant clicks the name of the patient, AI will tell them, okay, you have 15 roles on this particular patient. I have taken care of the 14 roles. You are supposed to take the blood pressure and take the x-ray of the patient. So this way my AI is guiding everybody to be able to deliver that specific work that it's asking them to do. Now if they do not perform that work, it gets logged into their error log. Okay. Now they have no excuse. Now that error they have to solve on their own, because if the front desk did not take the consent, it's on them. Now they have to go after the patient, get the consent, otherwise it stays on their dashboard and they can lose the bonus if they don't correct it in due course of time.
Right. And that's all trackable. It's all on this platform. It's called DentTracks. So if somebody wanted to check it out, DentTracks.com.
Yes, DentTracks.com.
And I'm sure you can find it on social media. I'm sure you can find it on LinkedIn, or even just message.
Yeah, I'm on LinkedIn, and I'm super available if somebody wants a demo. I think my link for the demo is on LinkedIn, and I'll be happy to connect with them.
Well, thank you so much for joining me today. Hopefully, they learned more about what your product entails, because it is a lot, but it's good. It's good workflow. So
thank you so much. Thank you for having me on the show.
Okay,
Thank you.
bye.